Hello, everyone. I'm Dr. Panagis Galiatsatos, also affectionately known as Dr. G by my community. I'm from the Johns Hopkins University School of Medicine. I co-direct Medicine for the Greater Good, and I'm a physician that practices at the Johns Hopkins Bayview Medical Center. And it's truly an honor to open the next panel. I'm sorry I cannot be there in person with you all, but I'm grateful for the opportunity to contribute to this important conversation. A little background. 7 years ago, with Medicine for the Greater Good, we launched a program that delivers social supports to many patients that are facing complex health challenges that culminate in frequent hospitalizations. The idea was a simple but powerful one. If these patients were facing social issues that impacted their health, well, maybe they needed social solutions. At the end of the day, we realized health must go beyond the medicine that we prescribed. We knew that addressing these social needs like social isolation, loneliness, food insecurity, and access to services would help change health trajectories. And it did. Today's conversation centers on a concept that feels both novel and deeply intuitive, that healthcare should meet people where they are, and to keep them healthy, they should go to community places where they are trusted. This approach, known as social prescribing, recognizes that medical care alone isn't enough. It's about tackling non-medical factors like social isolation or transportation barriers that impact health just as much as prescriptions or procedures. That's why I'm proud that Medicine for the Greater Good is partnering with Engage with Heart, a church and community-led initiative that brings together congregations, families, senior centers, and other trusted local institutions to support and promote heart health where it matters most, in people's neighborhoods and homes. Together, we're combining the strengths of both programs to support recently hospitalized patients, not just with follow-up appointments, but with real human connections. Since February 2025, our community health ambassadors from Engage with Heart are now checking in regularly on patients that were recently discharged not only from the hospital, but from the intensive care units. These check-ins ensure that these patients feel seen, that they feel supported, and that they do not feel alone. This builds on the foundation where we started so many years ago, and the remarkable work that Pastor King and his colleagues are doing have strengthened and reaffirmed these initiatives over the past 2 years. I'm most proud of this engagement in the works that it actually supports patients from a holistic standpoint. As I said, for a lot of these patients, their issue isn't medical care. It's the social complexities that oftentimes attenuate the medical care. If we can synergistically, socially prescribe and medically prescribe and ultimately work together, this benefits medicine overall, this benefits the patient, and it reaffirms medicine as a public trust. And let me be clear, it works. We've seen patients who used to cycle through emergency rooms and hospital stays in and out over the hospital. We've seen people once overwhelmed by their situations who would say, I don't know what I'm going to do. They felt defeated. Being a patient is a full-time job, and they had no one to help them with these responsibilities. That's the power of Engage with Heart. That's the power of Pastor King and his colleagues. That's the power of trust. That's what happens when care is built with communities, by communities, and for communities. Not just dropping in from the outside, but rooted in culture, compassion, and shared purpose. Specifically, we tap into the native intelligence and casual deliberation that makes social prescribing so powerful. Community health ambassadors are at the heart of this work. They are tailoring their approach to the complex health and social needs of each patient. They're checking in on neighbors after a hospital stay, helping folks get a follow-up appointment, and making sure medications are taken, meals are delivered, and no one is left behind. And what's the result? Yes, people are healthier from a holistic standpoint. The patients we have sent so far, since the beginning of 2025, not a single one has been rehospitalized into the intensive care unit. The amount of improvement from social isolation factors is growing. The amount of medication compliance has increased. These patients are learning to be patients in a more responsible way because of their community's impact, effort, and ultimately kind of a shared decision capacity. These individuals feel like people again, and they feel heard. Earlier, I got to emphasize this point again. Earlier, I said none of them have been rehospitalized, especially that 30-day benchmark that we always put. None of them have seen a hospital since they've been enrolled with this program within 30 days. To me, that matters because it showcases how we can meet the ethics of what we do with the economics of the healthcare system. This isn't just revolutionary. This is an evolution of what healthcare should be, especially considering that without this type of support, many individuals in similar communities face repeated hospitalizations over and over again due to their difficult to manage chronic conditions and limited access to so much preventative care. Each avoidable hospitalization can cost the healthcare systems upwards of $15,000, highlighting the real opportunity for both improved health and substantial cost savings. We expect this will translate not just into better health outcomes, but meaningful behavioral changes and long-term healthcare savings. At the end of the day, as we've been emphasizing, just helps people feel like people again. So today, we'll dig into why this works and how we can take it further. While we are mentioning how it is successful, we really need to make it significant and then take that significance and make it the standard. Medicine for the greater good and Engage with Heart show us that we invest in these roots, especially for our most vulnerable neighbors, for our most vulnerable patients, for our most vulnerable. We create real and lasting change. Let's build on the success. Let's make it significant. Let's make it the standard of care and grow this model across Maryland and beyond. With the support of our hospitals, our congregations, our senior centers, and other trusted community partners, we can reach people before they end up in the hospital. Thank you so much.